Anybody can come to Dubai from Kashmir or any part of the world, has a heart problem, he'll be taking free care from my foundation. Free care. Even they need stents, they need anything, it'll be done free of charge. Cardiac issue called coronary artery disease, blocked arteries causing heart attack, is the #1 killer in the world. But in Asia, including Kashmir, it starts in the younger population. If you look to United States, Europe, they're more in the latter part of the life, in their 60s and 70s. We see as young in their 30s having heart attacks and dropping dead. The reason is, honestly, we don't take care of ourselves. Take care of your high blood pressure. Let me tell you, you can prevent going to a hospital, you're going to prevent the heart attack, and most importantly, you may not even go outside Kashmir to have stents done, because the medications have tremendous progress. We have called statins, atorvastatin or rosuvastatin. The statins are anti-inflammation. You can reduce the heart risk by 50% by taking this medication. I call them vitamins of the heart. For children, I always tell the parents, don't force them, you want to be a doctor. No, they have to know what they do. You support them. I know doctors because they're physicians because mommy and daddy told them to become a doctor. They don't become good doctors. I'm going to develop this called interventional cardiology program, which I did in 1982 until today. 40 years later, I'm still there.
Welcome to Kashmir Life Science Talks. We are in season 3 and today we have a very special guest, Dr. Fayaz Shawl. He is a very prominent cardiologist, actually intervention cardiologist who operates from USA. And we will be talking about many issues within and outside the heart. Dr. Fayaz Shawl, welcome to the show.
Thank you, Mr. Hussain.
I'll start from a very simple question that is not essentially the medical science. Every time in literature, in spirituality, when we talk about the human body, we talk more about heart and less about brain. While science knows that, it has told us that that brain is the main operator of human body. Why is there overemphasis on heart, which apparently is a pump? Every poet talks about it, every spiritual leader talks about it, in all faiths across globe. Heart holds very important position in comparison to the brain. Why is it so?
Well, I think first thing is that to have a functional brain, functional body, you need blood. So blood pumps from the heart almost 5 liters a minute, so it supplies the blood to the entire body. So unless your heart is pumping, no other organ is going to function. But in terms of brain, there is a connection between the brain and the heart. The reason is, suppose somebody under stress, that comes from the brain, and then because of that stress, your heart can get affected. That's why when we talk about patients with heart problem, how important it is not to have stress, especially the external stress, internal stress, and because that will affect the heart function, heart circulation, and also most importantly, we have these arteries, which nourish the blood to the heart, called coronary arteries. So suppose there's a stress, they can clamp down. And when they clamp down, they can cause a stressful heart situation. So the answer to a question really is that there's a connection, but is the heart function, the pumping of the blood, almost 5 liters a minute, are important to function.
Hey, Dr. Fayaz Shawl, is just not a cardiologist alone. He is an intervention cardiologist, but he has also devised his own technique that is globally used now. We'll talk about later, but let us start, Dr. Shawl, with your own struggle, your own life, and your own learning curves that made you to move from Srinagar to US and creating a huge profile about yourself. There must be a lot of learning curves in your career. What was can you tell us about your life?
Well, I was born in Srinagar, called Shemaswari, and I went to middle school, then SP College, and while in college, I developed an interest in medicine, in biology, and then I went to medical school in Srinagar in 1967, and spent 4 or 5 years in the college, and then I did the internship. After that, I was sent to a place called Shahadra Sharif in Rajouri as a medical officer. But I always wanted to do something advanced, and I had this notion that the America is the best. So in order to go to America, you had to appear in an exam called ECFMG exam. So while in Rajouri, which was really a place where I was posted called Shahadra Sharif, in order to reach there, I had to take from airplane from Srinagar to Jammu, from Jammu to Rajouri in a bus almost all day, then by a horse to Shahadra Sharif. There was no road. So there was 3 hours by horse take me to the dispensary. I was the only physician for 6,000 people in Shahadra Sharif. And I was only 22 years old. But anyway, then as I said earlier, in order to go to America, you had to appear in an exam called ECFMG exam. So for that, I had applied to go to London to appear in the exam in London. That was the nearest center. And now we have in India. So I told the medical officer, I'm going to go for a week. He said, you can go, but I did not take any formal leave because nobody knows what happens in the Rajouri. But I told him I'm going to go for a week, and he said, fine. So I arrived in London, it was 1974, appeared in the exam, but I had to really struggle financially in my life because my father died very young. I was 13 years old, and my uncle really used to give us 100 rupees a month for food, which happened almost for 10, 12 years before I was able to make any money. But anyway, while in London, when I appeared the exam, I was not sure whether I have passed it. I was not sure. So I said, if I get some job here, although I was a medical officer in Shahadra Sharif, so that if I fail, I can appear in the exam again. So anyway, to make a long story short, I met this guy called Dr. Fletcher. One of my friends took me to his hospital. He said, wait a minute, you sit in the dining room, I'll be back. And a gentleman, an English gentleman, Dr. Fletcher came. I introduced myself, Fayaz Shawl. Then he said, what are you doing? So I'm doing the whole story that I have come here to appear in an exam so that I can go to America. He said, don't you like United Kingdom, UK? Oh, I said, yeah. He said, you want a job? I said, absolutely. He said, come on Monday, I'll give you an internship. So I stayed in England for then 2.5 years and did all my basic training there. But I was suspended from Shahadra Sharif because obviously I was absent. And then after that, you have to struggle as a foreigner in those days in the United Kingdom. You have to be better than the local guy. Okay? And then after that, I went to United States. I had passed my exam, but I loved United Kingdom because they have the best training when it comes to bedside. not high technology, how to get history from the patient, how to examine the patient, and you can tell patient's problem while he enters your consulting room. They say face is the index of mind. You can tell a lot from the face. I think that training I got from England for 2.5 years. And then I went to United States, and luckily I got exempted from residency because of my background in the United Kingdom. And to make a long story short, I was selected at Walter Reed Army Medical Center, one of the famous Army Medical Hospital, and they gave me an exemption to be in the Army hospital. Now while there, I heard that there's a guy, this German guy, Andrea Grunzig. He invented a balloon to open the arteries. I was fascinated. I said, I have to know what he's doing. So to make a long story short, I asked my chief of cardiology in Walter Reed, can I go to Germany to learn this technique? He said, what is it? I said, no, this is a new technique. You can open the arteries. And that is the birth of interventional cardiology, that you intervene besides diagnosing and doing procedures without surgery, without cutting open the heart. So I went to Germany, learned the technique, came back at Walter Reed, did the first angioplasty in 1981 at Walter Reed. First one in Army, Navy, and Air Force.
You did?
Yes. Did this technique, angioplasty. And it was a big thing in the United States. And so really I was lucky, and I had the opportunity and the timing. So then I stayed in the Army, and then, we were doing the balloon angioplasty, and then it got approved by the FDA in 1982, and then became the birth of interventional cardiology. That means as a cardiologist, you just not only diagnose things, you also treat them without open heart surgery. That really is the evolution of how it came up. And now, in 2023, it has revolutionized interventional cardiology. You can not only open the blocked arteries, you can open the blocked carotid arteries to prevent stroke. You can open the blocked arteries to nourish the blood to the legs. And now, recently, I've been doing called transcatheter aortic valve replacement, called TAVR. We can replace the valves, while until 7 years ago, you had to do open heart surgery. I go from the leg and I do open heart surgery. I do the procedure without opening the chest. So really, interventional cardiology has revolutionized since 1980. But thanks to Andrea Grunzig, my teacher from Germany, who taught me in 1977. Now, while I was developing this technology, developing these procedures, the biggest thing to me was patient may have a problem. And the biggest problem is if you die. Imagine going to the hospital, having a procedure, and then I had to come out, I'm sorry, he's dead. That's why I developed a called Shawl technique. The technique of putting a person on heart-lung machine without cutting through the leg. So suppose I'm doing a procedure, the heart stops. What do we do now? Heart stops, we do CPR, right? Medication, but in some people, they don't make it. But if I'm doing a procedure and patient basically dies, we do CPR. While we do CPR, within 5 minutes, I'll put this catheter in using my technique, and I can put the person on heart-lung machine, and even if he has no pumping, no function, this machine takes over for about 6 hours. But then I have these 6 hours to fix the problem. And it has really, we looked to a publication I made, we looked to almost my 23,000 patients I had done in my institution. Of that, 38 people died during the procedure. That is 0.2%. But there are 38 lives. We saved 35 using this technique.
So you had the honor of being the literally the pioneer in USA of this particular option which was actually was created in Germany. And then you had this shawl technique.
No, there are two things.
Yeah.
In Germany, the technique was developed to open the artery.
Yes, I understand that.
The technique I developed was later in 1988. If there's a problem during the angioplasty or complication and patient dies, that technique was already available. But for that, you have to open the chest or do a surgical cut down in the leg. But I was able to produce called percutaneous, go through the skin. That's what we call shawl. I did not. They proposed the name because I developed this.
So how popular it is with the intervention cardiologists across globe now?
You know, we don't really use it much often because now the intervention cardiology has got much more safer using stents. See, initially we used balloons and they will collapse and patient problem. Now we put stents to open the artery. You have less likely use of this heart lung bypass. But if a patient has a cardiac arrest in the cath lab while doing the procedure and the things fail, the patient is dependent on chest compression, this technique can be used. But that doesn't happen very often. It's a lifesaver, but the complication may happen in one in a thousand cases. So the use is very small, but it is lifesaver.
You, Dr. Shawl, somehow we couldn't get after you landed in US and then started working with an army hospital.
Yeah.
What was the later career graph? Where you went? Did you stay there for a long time?
No.
Or you moved to another hospital? Or you got into teaching? Or
okay, excellent question. Now, basically, in order to become a cardiologist, you need fellowship. So I did my fellowship in Prince George's Hospital for 1 year and 1 year in Army. Then I became eligible to be a cardiologist. It was 1980, all right? So then I stayed 2 more years in Army. And then I left the Army and I want to then start somewhere what I can start from scratch. So I had a lot of offers from bigger universities, Harvard, you name it. But I want to go to somewhere they have nothing. So I went to this hospital, Washington Adventist Hospital in 1982. And people said, he's going to this small hospital, they have no facility, is he crazy? So, but I met the administration, I said, I have a vision. I'm going to develop this called interventional cardiology program, which I did in 1982 until today, 40 years later, I'm still there.
You're still there?
Yeah, but while there, George Washington University want to have an association with me, so I have got people from George Washington University coming to my place and teach, and I go to George Washington. So I'm also clinical professor of medicine at George Washington University, associated with Washington Adventist Hospital. So I've been there, and while there, I have trained innumerable people. I have trained people around the globe using live demonstration courses. I'm actually operating, and on camera, they will see satellite. I've been to, you name it. Then because I'm an Indian, and want to do something to my own people and train them. There was a guy called Mr. Qasim. He met me in Singapore in 1990, almost 33 years ago. And he saw me doing these live cases. He said, come to India and teach our boys. I said, absolutely. So I started coming to India, and we'll go from Delhi, Bombay, Karachi, Lahore, Madras. I teach people how to do this balloon angioplasty. Then he said, can I send doctors to your place at Washington Adventist and train them? I trained who's who in cardiology, and they came to Washington. In fact, Upinder Kaul, he is one of those gentlemen who came to Washington 25 years ago to be trained. I have got Hundreds of people from India came, I trained them, and then back to their hospitals from Mumbai, you name, I have done actual procedures. So really, that was my biggest thing to help my colleagues and learn, because I had to struggle to develop something, but it was much easier to disseminate my knowledge to other people. That's a great feeling. I think that is the reason I want to do something for Kashmir, to give back. And now what I'm doing is training the people from India. And now India has become independent. We have excellent cardiologists here, we have excellent interventional cardiologists there. We're talking now almost 40 years later.
So, Dr. Shawl, we live in an era where we have passed the Industrial Revolution first and two. We are actually we have started reaping the benefits of Industrial Revolution 3 and 4, in which we have the most recent thing is the artificial intelligence, the virtual reality, all those IT things that are actually revolutionizing every sphere of knowledge. How are these tools, these techniques and these systems going to improve the way we treat heart, we manage heart?
Yeah. You know, I am little, I think the artificial intelligence will have a tremendous impact, but I don't want to take the human touch away. And in cardiology, we'll have a role of artificial intelligence in research papers, writing papers, giving us conclusion about all the patient's formulas and other things. But it is still in the beginning, artificial intelligence. In fact, I can tell you, with the use of artificial intelligence, we can take the sketch of the patient's heart and find the problem in a sketch. And the computer is going to tell us what size valve to use, what's the problem with the arteries. But personally, and a lot of people in interventional cardiology, there's nothing like the hands. The human touch, I don't think will be affected much with the artificial intelligence.
But there are devices now which actually help in early diagnosis of things.
Oh yes.
We have watches that detect things much faster than a lot of CTs we do.
Oh, I see. Let me give you an example of the iWatch. If somebody has, one of the most common abnormality in older population is atrial fibrillation, irregular heartbeat, and that can lead to a stroke. And iWatch can pick up atrial fibrillation. A simple iWatch, Apple iWatch. I'm not making a commercial for iWatch, but it can pick up this irregular heartbeat, the number one cause for the stroke. But we have also devices now we can put under the skin, called a loop recorder, and while the patient is doing his activity, we can monitor him. Same as the pacemakers now. Suppose you put a pacemaker in and the patient has problem, we can remotely assess what the problem is, especially the irregular heartbeat or a fast heart rate. So I think the technology has really grown, and the one I was talking to earlier, replacing valves, which is the older you get, the problem with the valve, and what happens to the patient with this valve called aortic stenosis, they feel short of breath, they feel tired, they have no energy, they think, oh, I'm getting old. It's most common in age 70s and 80s. I did a patient who was 98 a couple of weeks ago in Washington. His main complaint was, I can't walk, I'm so tired. It was all from the valve. And I do from the leg, open the valve, and put an artificial valve called TAVR. So that's revolutionary. Well, 10 years ago, we couldn't do this thing at that age group. Basically, anybody is 70, 80 years old, he has got bad valve, we'll say, listen, with open heart surgery, there's a lot of risk, and they would now come for this new technology, replacing valves without opening the chest.
How near is humanity to a situation where we can carry our mechanical hearts in our backs?
Okay, well, you're talking in patients who have got severe heart failure.
Exactly.
their pumping is normally pump is like this, the pump is like this. They have no pump. So we're using artificial heart mate. We put a small catheter in and carry on the back pocket the heart. It works, but it's for those people who have got muscle is so weak, called ejection fraction is 10%, 15%. They can breathe, they can do any activity, and this artificial heart, which is outside pumping, until we get the actual heart transplantation. So it's a bridge to the heart transplantation, which is very, very effective, putting a new heart, but you can't get the donors. So while you're waiting for a new heart, you can put artificial heart mate. But there are some people, in their 70s, they have diabetes, they have kidney function problem, they can't have a new heart, but they can use the pump. It's just revolutionary what we're doing now in medicine.
So for concluding this the knowledge conversation, I just want to ask you, see, you are operating from a place which is near ultimate to a knowledge economy, where everything happens, where the best standard practices in different spheres take place. You see the world, you see the trends, you see the research. Can you tell us something about the state of heart in Kashmir and the state of cardiology in Kashmir?
I must admit, I have seen in the past at SCIMS. They have a lot of nice facilities, very nice hands to do intervention. Because I was here about almost 10 years ago. I found there's a lot of expertise in Kashmir and a lot of good equipment. But really, when I saw yesterday this place, Paris, so really they have tremendous technology there in terms of infrastructure, in terms of modern equipment from CAT scan to MRI to the cath lab and other ancillary. I was very impressed with that institution, with the infrastructure.
I think we have other private sector hospitals as well who have cath lab.
Yes.
Cath labs who have CT scans and...
Oh, I'm sure. I have heard. I have not seen them personally, but I'm sure if they have the same equipment in other private sectors, that is great, which wasn't 10, 15 years ago when I used to work and do some cases at SCIMS. But I think, the most important thing is I'm a Kashmiri. When I can do what I'm doing, they have same brain, there's no difference. And I interacted with many physicians from SCIMS and also from Paris Hospital. They're very good. I think they're very good. There's a tremendous scope. What I really want to give people this kind of technology who have nothing, who have no money, right? Because people go to outside Srinagar, to Delhi and other places. I think there's a flow of so many patients going to out of state. I think if we have an infrastructure like Paris and other private sectors here in Kashmir and provide them the same services as in outside Kashmir, we can really, really make a tremendous progress and then give people who have nothing the benefit. That's why when I had a plan to open a hospital, my aim was build the rich and feed the poor, because I'm really is a foundation, Fayaz Shawl Philanthropic Foundation. In fact, I have now that in Dubai, because I get patients, before 9/11, I used to get patients in Washington. But now I've moved to Dubai every 3 months for 5 days, and anybody can come to Dubai from Kashmir or any part of the world, has a heart problem, he'll be taking free care from my foundation. Free care. Even they need stents, they need anything, it'll be done free of charge. Because God has given me enough. So I want to give back.
Is there a possibility of having at least one visit, a week-long visit in Srinagar? You can tie up with some private sector hospital where you can do the procedures here. Is it possible?
Well, as I said yesterday, I've been here 5 days. Mr. Trumbu, I think, yes.
Yes.
Mr. Trumbu invited me to come to Paras Hospital. He said, have a look and can you come here and help us out? So I had to think about this. But my aim is basically to help Kashmir to that extent that they will have an infrastructure, technology, and the doctors to take care of them here in the valley, particularly with the heart patients who are going outside the valley. And the profits to make and give to the poor people. That's my hope. And as I said, I was offered yesterday by Mr. Trumbu. I said, I'm going to think about.
So the other part of it is, a general impression in Kashmir is that we have more heart issues with the population.
Yes.
We have instances of people playing cricket and dying on the pitch.
Yeah.
People moving around and collapsing. Are we exhibiting an above average rate of cardiac issues in Kashmir? What do you think?
Well, let me tell you one thing. Cardiac issue called coronary artery disease, blocked arteries causing heart attack, is the #1 killer in the world. But in Asia, including Kashmir, it starts in the younger population. If you look to United States, Europe, they're more in the latter part of the life, in their 60s and 70s. We see as young in their 30s having heart attacks and dropping dead. The reason is, honestly, we don't take care of ourselves. We have stress. We have got diabetes epidemic here. We have got high cholesterol because eating habits was one and all that stuff we eat. Also, a lot of high blood pressure, smoking, and family history, and a stressful situation. There's a prime thing to develop this problem, and the #1 cause. But there is a way out.
What is it?
#1 is right from, I got children with me from Washington, we walking 30 to 45 minutes 3 times a week, not to be sedentary. 2, if they're diabetic, make sure they are taking the proper diet and look at their blood level called HbA1c below 7. Check their cholesterol level, because we have a very low HDL because we're sedentary, but you have also high LDL level. So you want to take medication to get that LDL down after you change your lifestyle. Smoking, even secondhand smoking, somebody's smoking at home, his wife is going to be affected, his children are going to be affected because of secondhand smoking. And then finally, the family history. People who have family history should have early checkups. And also, I look my heart or heart issue like a car issue. Suppose you have a car, you get your regular service, right? If you don't do regular service to a car, what will happen? It will stop in the middle of Residency Road. It will die. But same is heart. If you do early checkups, especially if you are age 35 and above, or a woman after menopause, have these checkups. Check the cholesterol, check the HbA1c level. We do also plain stress tests in men, especially when you have these risk factors. That they have smoke, they're sedentary, they're diabetic, they got high blood pressure, their family history. Because those are the people, I call them walking time bombs. And even you don't need angioplasty. It's a little, to be honest, overused. Stents, they're still overused because we have tremendous advances in medication and the lifestyle changes. If you do lifestyle changes honestly, eat right, take care of your blood sugar level, take care of your high blood pressure. Let me tell you, you can prevent going to a hospital, you're going to prevent the heart attack, and most importantly, you may not even go outside Kashmir to have stents done, because the medications have tremendous progress. We have called statins, atorvastatin or rosuvastatin. The statins are anti-inflammation. You can reduce the heart risk by 50% by taking this medication. I call them vitamins of the heart. So really, to make long story short, a patient can do a lot by themselves, but for that we need awareness program by media, by the television, to tell people, hey, what you should do. Because honestly, I have a great belief, just like in the United States, what have been almost 45 years, that we can prevent things. Look at if somebody is 70 or 80 years old in Washington, there's a young man who is old and 90. People still walk there in their 80s and 90s, have treadmill, and watch their diet, because that is very important, and be active. Don't be sedentary.
Dr. Shawl, to conclude this knowledge conversation, what usually happens is you have students across the globe. You have taught people, you have helped them pick up the techniques you devised and the best practice. But is somebody in your family inheriting what you know?
Even my own children?
Yes.
Well, my oldest son, David, he's a cinematographer in Hollywood. My son is paramedic, emergency medicine. And my daughter she likes animals, so she wants to go into a veterinarian. But for children, I always tell the parents, don't force them, you want to be a doctor. No, they have to know what they do. You support them. I know doctors because they're physicians because mommy and daddy told them to become a doctor. They don't become good doctors. You have to have that passion. No matter what job you have, you need a passion. If you want to become a driver, be a driver. If you want to be a nurse, be a nurse. Because it has to come from the heart, from the brain. So that's what my children, they're not out, except Jonathan, he's in paramedic and he loves emergency. Paramedic means, suppose somebody has a heart attack, they can treat on the road, or somebody's having chest pain, they call 911 in US and the ambulance will come and they can do everything before reaching the hospital. See, a lot of people die here young, in Kashmir and in Asia, younger than, because they have these risk factors, high cholesterol, diabetic, and boom, have a heart attack and die. But to make long story short, I still want the parents to support their children what they want, because don't force them to be an engineer, don't force them to be a doctor. They have to know their own, and then they become very successful. I'm a Kashmiri, I have the same brain as your brain or anybody in Srinagar, no different. But my passion was from the beginning to be a physician.
Dr. Shawl, you spared so much of time for us. You talked your heart out, actually, a cardiologist talking about the heart and speaking from his heart are great things. So we hope the next time you come, we'll have another reason to have an interaction. Dr. Shawl, so great of you that you could give us so much of time.
Thank you very much. I'm truly honored.
Thank you.
Thank you.